Okay, sir. Just a minute. Uh, you people are aware about our product, na?
Yes, sir. They are aware.
Okay. Have you visited? You people have the visual or not?
Yes, sir.
Okay. Please show me. Okay. You have got this visual today or day before?
Every day it will be in our bag itself.
No, no. Today you have got this visual bag and visual, etc.
No, sir.
Cutting material today.
Two days back, sir.
Okay. Today you have got the bag, visualate and promotional materials, right?
Yes, sir.
Okay, great. So just before I am going in the product training, so just look at your visualate all the pages, all the brands especially, right? Everyone, please, quick, fast. Just look at the brands, brand pages actually.
Yeah. Yes, sir. Finished.
Finish.
Yes, sir.
Okay, great. I want to just you know about brand, right? Just you have aware about brand because when you understand the brand means awareness about the brand, so it will better to understand what basically I am going to train. Right. So what is your opinion while looking entire the brand portfolio? What you say, which category, which specialty?
Gynecology.
फ्री ट्रेनिंग में हूँ. हाँ, गवर्नमेंट ट्रेनिंग में हूँ, फ्री कॉल करता हूँ. Right, you are all aware about that. We have the brand from the gynec segment, right?
Yes, sir. Yes, sir.
Almost brand from the gynec segment. So one thing is very clear कि हमको जो है gynec में काम करना है. We have focus on the only gynec segment and we have come up with the unique specialized brand friend, and these brand have his own USP actually. One by one I will explain why we are choosing this brand, what is the differential as compared to the available options. हाँ. Right, so you will better understand. So फर्स्ट नंबर पे है, बात कर लो इसी में चाहे डाल करके. So first we are going to the product training. First we understand one basic concept basically, friend, because without understanding that we are not completely understand the product. So first we understand female reproductive system in brief, right? First we understand female reproductive system because जब तक हम फीमेल रिप्रोडक्टिव सिस्टम को नहीं समझेंगे, when we are not understand the female reproductive system, till we are not understand about the brain, because in the female na 90% of disease happen generally in the reproductive system. 90%. Most of the female जो suffer of suffering from diseases, most of the cases, 90% cases, they have problem in their reproductive health, your reproductive system. God make a reproductive system is a very complex, female reproductive system is a very complex system, right? So first we understand in very simple language what is the female reproductive system. क्या रिटर्न है? पूछ लो क्या है रिटर्न, वो प्रिंटर के ऊपर रखा है, मे भी वही होगा. Right, friend. So first we understand female reproductive system. So the female reproductive system is responsible for producing eggs, that is also called the ova, supporting pregnancy and giving the birth. This is the basic brief outlining of the female reproductive system. What is the work? They produce the egg, that is called also called the ova. Second is support the pregnancy, right, for the baby growth. And third, giving the birth to the baby. This is the basic function of the, this is the basic functionality of the female reproductive system. It includes both internal as well as external organs, means internal organs and external organs both. Main parts and their function. This is the very important because you are not from the gynec segment, you are not allergic with the gynec segment. So understand clearly what are the parts of the what are the parts and what is the work of the female reproductive system. So this is the female reproductive system, right? This is the female reproductive system. This is the internal part. We are talk about the internal part because all medicines are disease from the internal part. We are not going to discuss about the external part. So here in the structure, you look at the, this is the, this U-like structure that is called the fallopian tube, right? This structure called the fallopian tube. And this red color structure, just like a ball, called the ovary. घर पे है फिर. Second, this is called the uterus. Uterus means, friend, the place where baby basically come and grow actually, right? So ovary, second fallopian tube. This is ovary where egg is made. Second is the fallopian tube. First egg is made here, then they come here, fallopian tube, come in the fallopian tube, and through the fallopian tube, they come in the uterus to grown as a baby, right? And these all the steps we learn one by one. So easily you can understand all the step and part. So first we discuss the ovary, right? This part, this red part, right? This is the ovary. Ovary, you can think like that. This is the egg factory. They make every month egg, right? It is an egg factory. They every month prepare the egg or ova, right? Egg or ova is the same thing. They every month prepare the egg because for the fertilization, two things is needed. One is the egg, second is the sperm. So female part is the egg and male part is a sperm, right? Male sperm goes to the ovary, goes to the fallopian tube and combined with the egg, sperm combined with the egg and do the fertilization, this combining process called the fertilization, and yes, then baby formation occurred, right? This is a simple step. So first we understand the ovary. Ovary, the basic function of the ovary is to produce eggs, make a good quality eggs, right? Produce eggs and make a good quality eggs. So two small organs that produce eggs and female hormone estrogen and progesterone. So ovary basically they produce egg as well as produces two hormone. One is the estrogen, second is the progesterone, right? One is the estrogen and second is the progesterone. So please remember the name of the hormone. This is a very important hormone that is helpful or that is responsible for the growth of the kids, not kids, baby actually, right? This is the main develop estrogen and progesterone. Both hormone are responsible for the growth of the baby. Here I give the structure of the female ovary. This is the corpus. We are not going to deeper way. What are the names? What are the how they work? But just remember one thing. This is ovary, and function of ovary is that to produce the eggs. Right? This is the structure of ovary, but doesn't need to go depth here to understand all the process. Right? क्या कर रहे हो आप? जाओ भी अंकल के साथ खेलो ना. Right. So we are not need to go in the deeper way to understand all the things. Have you any query, friend? If you have any query, please let me know. One thing is clear. One thing is clear.
Yes, sir.
Right? Have you any doubt? Just remember one thing. So ovary and function of ovary is to produce the egg. They produce the ova. Meaning is same. Right? Ovary, they produce the egg. And the production of egg, that is called the ovulation. Just remember three words. One is the ovary, second is the ova, a third is the ovulation. Just remember three words: ovary, ova, and ovulation. Right? Please remember three words. This is very important word, and they come in many times when you promote your brands, when you talk about the reproductive system, every time. Right? So this is the ovary, and function of ovary is to just make a ova and produce embryo and ovulation through the ovulation process, right? And this is the structure: corpus, ovulation. How they ovulate? This is showing that how ovulation happen. Just egg here, primary follicle. And another name of the egg is follicle. Okay. Another name of egg is follicle. Follicle, egg, and ova. These three are same, right? Their meaning is same. You can speak, you can tell him ovary, sorry, ova. You can tell him the egg. You can tell him the follicle, right? So first, the small primary follicle develop, then they grow, then mature it, and after maturation, it just come out bahar and get called the ovulation. Release one egg each month. One egg each month. And female have the two ovary. Female have the two ovary. So 1 month this ovary produce the egg, and next month this ovary produce the alternate, right? In this and alternately they produce the egg. Clear?
Yes, sir.
Alternate. So every ovary alternatively just produce the one egg for the baby formation. Clear to everyone? If any confusion, please speak.
No, sir.
If you have any doubt, any confusion, please speak. हम यहाँ पे we are थोड़ा सा slow चलेंगे, right? To understand entire system कि हमारा जो product है, we have our entire product portfolio just based on these small parameters. All the medicines they work here. They all trying to correct these problems. First, we understand normal system. Then we understand what happened if disease occurred, right? So first we clearly understand the normal situation. Normally what happen in female body? First we learn the normally what happen, right? This is the first step. Ovary produce the egg. Second is the fallopian tube. So friend, this tube, this L-like structure, you can say that, the U-like structure, you can say that, this is called the fallopian tube, right? This is called the fallopian tube, this one. So two fallopian tube, this one, and this left and right, two fallopian tube in the body, because two ovary. So this is like, just like in the male, two test. We have the two testes now.
Yes, sir.
We have the two testes, one penis, right? Same thing happen in the female, one uterus, but two ovaries. We have the two testes, female have the two ovary. Our testes are make the sperm and female ovary make the egg, right?
Yes,
So
sir.
fallopian tube. Fallopian tube is a transporter, egg transporter. Basically, here ovulation happen, and just this fallopian tube transmits this egg to the uterus, right? Just the work of the fallopian tube is to transport the egg from fallopian tube, sorry, from ovary to uterus, right? The basic work of the fallopian tube to just transport. Just here, when egg is come out here, they just carry out this egg to the this uterus. Clear? संजय समझ में आ रहा है?
Yes, sir.
Yes, sir.
Thin tubes that connect the ovaries to the uterus. Fallopian tube, basically they connect the uterus to the fallopian tube. The egg travels these tube after the ovulation, and fertilization, sperm meeting the egg, happen here. So what happened for the pregnancy, friend? When we do the intercourse, that time our sperm just crosses this barrier, right? This is the vagina. This is vagina. Through this vagina, sperm come, and this is the cervix. To enter the cervix and come and reach here. मेरा कर्सर दिख रहा है आप लोग? कर्सर is visible,
Yes, sir.
right? So sperm travel these distance and reach to the egg. When egg is ovulated, when egg come out from the ovary, they wait for the 24 hours from the sperm, right? When ovulation happen, then is egg wait for the 24 to 30 hours for the fertilization in fallopian tube. When ovulation happen, just immediately they doesn't come the uterus. First they wait. रमेश से door close कर दो. Right? So egg waited for the 24 to 30 hour, 32 hour for the fertilization. So for creating baby, we need intercourse when ovulation happen, right? When ovulation happen, that particular time, if couple do the intercourse, then baby occurred. Otherwise, entire month, if they do the intercourse, there is no chance of the pregnancy, right? तो आप लोगों में से मैरिज कौन है? Those have the marriage, they know this cycle, because
Yes, sir.
for this cycle we need the intercourse for generation of the baby, for generation of the next generation.
Yes, sir.
Everyone married?
Sharat not married.
Sharad not married. So Sharad have not experience, but giving you the experience for creating baby, you need to do the intercourse after the ovulation. And this time occurred after period, when period end something around after the 7 to 10 days. After 7 days, when time is start from 7 days. When period in menstrual cycle end, then after 7 days, leave 7 days, then do the intercourse for the baby creation. Right? This is the process. Many unmarried people doesn't know, right? So because of this reason, almost they take 6 months to 1 year to know how to create the baby, right? Because these things are not teaching in the college. Okay. So egg wait for the 24 to 30 hours for the fertilization. If fertilization happen, right? If fertilization happen, then this embryo that is fertilized after fertilization, this is called the embryo come to the uterus, right? First, but we understand the parts. Uterus, and in uterus we also call the womb. Uterus we also call the womb, and this is the baby womb. This is also called the baby womb, a muscular organ where a fertilized egg implant and grow into a baby. If no pregnancy happens, the uterus sheds its lining during the menstruation. So if fertilization friend happen in the fallopian tube here, then the fallopian tube circulate this embryo to the uterus. This is the uterus, and here the baby is implanted. Here the baby is implanted for the further growth. If fertilization happen, and if fertilization is not happen, then this muscular layer, this is also called the endometrium, this is start breakdowning. This is here when fertilization, when egg is developed na, that time those two hormone, one is the estrogen, second is the progesterone. These two hormones, they start creating the one inner lining for implantation of the embryo, right? When ovulation happen, same time two hormones also secreted, one is the progesterone, second is the estrogen. So these two hormones, they start developing the inner layer at the uterus, that is called the endometrium, right? That is called the endometrium. Here one inner lining, thick lining is developed, that is called the endometrium. And this thick lining is developed because the implant will be stable, so baby can grow here. Understand? But
Yes,
if implantation not happen, means fertilization not happen, that time this inner lining is breakdown and come out bahar as a menstrual cycle, and that is also called the period, right? Through the cervix. And what is cervix? This is the gatekeeper for the baby born. Many time you listen this word cervix abhi open nahi hua hai. When pregnancy happen for the delivery, when doctors just put in hand in the vagina and check the cervix size, one finger opening, two finger opening, three finger opening. When two finger opening happen, then baby can easily come out, right? Two to three finger. If in two to three finger, normal delivery happen. So just just a gynecologist just putting his hand in the vagina to check the opening of the cervix, right? For the development of the baby, till the development of the baby, this cervix is closed, because in above the cervix here the baby is presented, baby growth, baby is presented, right? The lower part of the uterus connecting it to the vagina, right? So vagina, jo cervix connected with the vagina for the baby birth. In the reproductive system, if we talk with the urinary system, it is the alag separate connection, right? So for the baby born, it is different connection, this different tube, and for the urinary bladder, it is a different connection. Here is the two tubes. Here we are showing only one tube, but behind this one tube also happen. So for urination, it is different tube that is connected to the bladder, and for the baby born, this is the cervix, the connected to the uterus. Open slightly during menstruation and widely during the childbirth. It is slightly open during the menstruation. When this inner lining, when menstruation is sorry, in the if fertilization is not happen, then this inner lining that is called the endometrium is breakdown, and breakdown after breakdown they come out every month in the cycle of 28 days. So small opening happen in the cervix, right? So small opening happen with the cervix, and all the cells and egg come out as a form of the menstrual cycle as a bleeding. Clear to everybody?
Sir.
Yes, sir.
How menstruation happen and what are the process happen, right? All
Yes, sir.
all the reasons of the infertility in the female, these all the steps involved in the infertility, basically these steps are involved. Sometime problem happen in the ovary, sometime problem happen in the fallopian tube, sometime problem in the happen in the cervix, sometime problem happen in the uterus, right? The major reason for the infertility, these are the small steps. In these small tiny steps many times not happen due to hormonal imbalance or due to other different reason. But before going to further, you people are understand the how menstruation happen or how baby born. Vagina is a birth canal. You can say that vagina is a birth canal, a flexible tube leading from the cervix to the outside of the body, allow the passage of menstruation flow and sperm and childbirth. Right? This is the work of the vagina. So in summary, how it works, first step is that egg release. That is called the ovulation. The ovary release an egg. Second step is fertilization if sperm is present. Means if married couple doing the intercourse, then fertilization happen. Then egg meets with the sperm in the fallopian tube. Third step, when they meet and form the embryo, then third step is the implantation of the fertilized egg. So implantation means pregnancy start. The fertilized egg attached to the uterus. They attach to the uterus, this place. And menstruation. If pregnancy not occurred, then menstruation happen. The uterus shed its lining. They come out in the form of blood as a we call the period. Clear to everybody?
Yes, sir.
Yes, sir.
Very clear?
Yes, sir.
Because the crystal clarity is required in all the process actually. Crystal clarity.
Yes.
Because when we are going to study all the brand now, when that time I take the name of ovulation, implantation, fertilization, problem in the fertilization, problem in the implantation, problem in the egg development, right? Step by step process of the female reproductive system. So we learn in detail one by one step with the hormone name. Here I simply explain all the things in the very layman language. But we learn some is little bit complex system, because here the major role for the entire system, major role of the hormones actually. So how hormones change the things and what happened. So first step is the egg production, that is called the oogenesis or ovulation. Ovulation is the process where egg come out from the ovary, but the process of egg formation within the ovary called the oogenesis. Like in the female, we call the spermatogenesis, the process of sperm formation, right? The process of sperm formation called the spermatogenesis. Clear? The process of sperm formation called the spermatogenesis. Same in the female, the process of egg formation called the oogenesis. Clear? Ovaries contains thousands of the immature egg from the birth. When any child birth, any baby girl birth, They birth with the thousands of eggs, but these eggs are immature. Understand? They
Sir.
birth with the eggs, thousands of eggs. That is also called the reservoir. And these numbers are limited. Understand? Means we just generate counted number of babies. This is not unlimited babies. So counted number of eggs present. So ovaries contains thousands of immature egg from the birth. Each month one egg mature and released during the ovulation. So each month, every month, one egg will mature and release. Which hormone is responsible for the ovulation? One is the FSH, follicle stimulating hormone. Follicle stimulating hormone helps the egg mature. Basically, follicle stimulating hormone, they help the follicle to mature as a egg. And then estrogen and progesterone regulate the menstrual cycle. Second step is the ovulation. In the first step we make the egg. In the second step we just do the ovulation. Happen mid cycle, day 14 in a 20 years day cycle. So every female have the different day cycle. Some female have the 27-day cycle. Some female have the 26-day cycle. Some female have the 28. Some female have the 29. Some female have the 30-day cycle. So 28 days is a common, most of the female happen because we consider the 28 days, but it is not fixed. It is different female to female, right? And in the जो ovulation का process होता है, the ovulation happen at the mid cycle, that is 14 day, and it is also not fixed. It can happen in the 12th day, it can happen on the 13th day, it can happen on the 15th day, right? But most of the cases is happen on the 14th day because we consider the 14th day. Luteinizing hormone trigger the ovulation. The one hormone that is called the luteinizing hormone. So luteinizing hormone, they trigger the ovulation. If luteinizing hormone or LH deficiency, then ovulation not happen, right? So disease can happen. If female body have not enough quantity of LH, so ovulation will not happen. So infertility happen, right? Because of that reason, infertility happen. So LH is responsible for trigger the mature egg into the fallopian tube. Egg can survive for the 24 hours for the fertilization. So egg wait for a 24 hour, is some sperm come and fertilizes, right? They wait for the 24 hour. Step 3, egg travel from the fallopian tube. There, if fertilization happen, then travel to the uterus. If fertilization not happen, they break down and inner lining and endometrium will break. Sperm meet the egg in the fallopian tube. These all for steps I explained already. Then zygote formation, the first cell of a baby. The zygote divide into the multiple cells toward the uterus. Implantation. For the implantation frame, one hormone is very important, that is called the HCG, human chorionic gonadotropic hormone. Human chorionic gonadotropin hormone. This is called the pregnancy hormone. This is responsible to stop the menstruation. First, second, for the nourishment of the fertilized egg or embryo, right? This is, they stop the menstruation, they strengthen the inner lining endometrium, and they nourish the egg actually. So sometime those female have the 2 month abortion, 3 months abortion. In that case, doctor suggests the SCG injection or the weekly basis or twice weekly basis, right? A lot of companies selling the SCG injection in the market. the uterus start forming the placenta to support the body. Menstruation, if not fertilization, the menstruation happen. Okay. Summary of table. This is the day-wise plan. How, what is the happen in the female body, and which hormone is responsible for doing this functionality. So one is the menstruation phase for 1 to 5 days. Some female have the 3 days menstruation. Some female have the 4 days menstruation. Some female have the 5 days, and some female have the 6 days menstruation. Some female have the very much pain during menstruation. Some female have the stress and anxiety during menstruation. मतलब every female have different symptoms, friend, when menstruation start, right? And before menstruation also mood swing, abdomen pain, these things happen. This is called the premenstrual syndrome, right? We have the medicine also, but this is called the premenstrual syndrome. So before start menstruation, they have the acute pain in the abdomen area, yeah, uterus area. Some female have the mood swing, chidchidapan, right? Some female have very much anxiety. Different female, different have the symptoms. So 1 to 5 day uterus sets its lining period, low estrogen and progesterone. Day 16 to 14, egg mature inside the ovary. So for the maturation of the eggs, which hormone is responsible? Responsible FSH, follicle stimulating hormone, and estrogen. So day 14 is egg ovulation, right? Release of the egg into the fallopian tube. For this release, which hormone is responsible? LH, luteinizing hormone, that serves the trigger for the ovulation. And this time, yes, intercourse is required for the baby. In 15 to 28, the uterus prepare for the pregnancy. If no fertilization, lining start to the set, and pregnancy progesterone increase, then drop. Right? These are the basic, basically system. I want to. Anyone can explain this entire process. How menstruation happen? Just I open the structure. Anyone can explain step by step process, what happen, happen, how babies form, how menstruation is happen. Anyone? Step by step. What are the first step? Then next step. Then what happen with the egg? If fertilization happen, then how body is prepared. If fertilization not happen, then how body is prepared. Like that. Step by step process. I want to know the step by step process, because clarity of these all steps is much important. If you not understand this entire menstrual cycle, then you never understand the brand. The all the brands, we have all the brands, they work on these steps, right?
Yes,
Okay,
sir.
Sarad, can you explain?
Okay. Sir, sir, it starts with the female reproductive system.
Hmm.
In female reproductive system, the uterus is there,
Hmm.
and two ovaries will be there. Two ovaries will produce alternate day, alternate month. It will produce the egg. 1 month, one uterus will produce the egg. Another month, alternate uterus will produce the egg. After that, when intercourse happens, the sperms travel through fallopian tube.
Hmm.
When the egg has been produced in the ovary, it gets fertilized with the ovary. The sperm will fertilize with the ovary.
Hmm.
It takes around 32 hours, 24 to 32 hours.
Hmm.
So the baby grow will happen there, sir.
Uterus. Boom, boom.
Okay. Same, I want to know all the things from Sarad. All the steps. अभी शरद को थोड़ी जरूरत भी ज्यादा है ना, जो आफ्टर फ्यू ईयर और मंथ. So understanding level is, if have the clarity, then immediately marriage, just new Sarath come out, right?
And
So clarity required for the new Sarath.
and in ovary there are two answer produce madam.
We have also two other rap. One
Estrogen
is the
and
Arjun,
Estrogen
and
and progesterone.
second is the Devaraju. So Arjun and Devaraju, please open your camera so we can interact.
estrogen.
Arjun and Devraju. I am speaking those names that just display on my screen. I'm not knowing exactly what is exact name, but whatever display on my screen, I speak accordingly. Arjun and Devraju.
Yes, sir.
Please open your camera. Okay, great. Arun, sorry, Arjun, I am speaking. Arun. Arun is also the next rap, na? Arun is a medical rap, na? Arun, he is connected or not? Because please call him. He is connected or just connect the phone and sleeping. Many time in the Zoom call, na, people just relax. Even that people attending the video call just reviewing the class.
I will inform to you, sir. I will inform to you. Just a minute, sir. I will inform to you.
Hmm? Okay, Sarath,
Sir,
please explain what happened from follicogenesis to baby formation. All the process first. Second, from follicogenesis to menstruation cycle. Two process happen. When one is the baby formation, second, if baby formation is not happen, then menstruation. So explain step by step, one by one. Even that I just share the table, na. In that table I am just mention all the things. In very this menstruation cycle is a very big cycle, right? They need one day, whole day to explain actually. But I make very small, very simple, in very layman language though, so you people all understand easily. And I'm trying. If you are not understand, then I will explain again. There is no issue. But whatever you learn, whatever you are, what is your understanding? Even you can speak in your local language. There is no issue.
ನಿಮ್ಗೆ ಅರ್ಥ ಆಗಿದೆ ಅದನ್ನ ಮಾತಾಡಿ.
Local language. Your manager will understand. If I'm not understanding, your manager will understand.
ಹೇಳಿ ಅವ್ರು ಹೊಡಿ and what will the even explain ಮಾಡಿ ಅಷ್ಟೇ. ಮಾತಾಡಿ ಏನ್ ಗೊತ್ತದನ್ನ what ಏನ್ ತಿಳ್ಕೊಂಡಿದ್ರು ಅದನ್ನೇ ಮಾತಾಡಿ.
ಮಗು ಹುಟ್ಟೋದು ಹೆಂಗೆ ಅಂತ ಹೇಳ್ತಾರೆ.
ಅಂದ್ರೆ ಬೇರೆ ತರ ಅಲ್ಲ, ಪ್ರೋಸೆಸ್ ಯಾವ ತರ ಇದೆ ಅಂತ ಅದನ್ನ ತರ ಹೇಳಿ. ಹೇಳ್ಬೇಡಿ.
आप ना कैमरे का ब्लर बंद कर दो. ये ब्लर बंद करने, इसकी वजह से सब लोग नहीं दिख पाते हो.
हमारा सर
ब्लर प्लीज, जस्ट ऑफ द बैकग्राउंड ब्लर.
सर हमारा ब्लर आ रहा है.
Sarath, have you any problem? Please let me know, yaar. Even that if you are not comfortable with the English much, you can discuss with your manager, understand all the steps, and explain in your language. There is no issue at all. But my concern is that you understand all the steps, because we have the medicines those only work in this 4 5 steps, and all the infertility reason just come around in these 5 steps. 90% female disease happen this the problem in these cycle actually.
No, see, actually, basic what the language is. You can mix up it and you can say. Sources ಏನು? What is the reproductive system? So how it will work? ಈ ತರ basic ಅಲ್ಲೇ ನೀವು ಮಾತಾಡೋದು.
So female reproductive system.
ಜ್ವರ ಇದೆ.
So female reproductive system.
It produces
Uterus.
eggs.
Produces the egg.
ಇಲ್ಲಿ ನೋಡ್ಕೊಂಡು ಹೇಳು. How much?
Look at the steps. Look at the steps. Understand all the steps. And then explain me.
5 days are able to.
See, you stay simple. Sir, menstrual phases day 1 to 5. So uterus sheds in a lining period. So, once you know, you will just stop. And then explain ಮಾಡಿ. Okay. Explain ಮಾಡಿ. See, nervous ಆಗ್ಬಿಡ. ಯಾರು ನೀನ್ ಇಲ್ಲ, ಏನೇ ಮಿಸ್ಟೇಕ್ ಆದ್ರೂ ನಾವು ಇದು ರೆಕ್ಟಿಫೈ ಆಗ್ತೀವಿ, ಡಾಕ್ಟರ್ ಮಿಸ್ಟೇಕ್ ಆಗ್ತದೆ. ನೀನೇನ್ ತಿಳ್ಕೊಂಡಿದ್ಯಾ ಅದನ್ನ ಧೈರ್ಯವಾಗಿ ಮಾತಾಡೋ, ಧೈರ್ಯವಾಗಿ ಹೇಳು. ಸರ್ ಈ ತರ ಆಗುತ್ತೆ ಸರ್, ಈ ತರ ಆಗುತ್ತೆ ಸರ್. ಓಪನ್ ಆಗಿ ಮಾತಾಡೋದು, ಧೈರ್ಯವಂತ ಮಾತಾಡ್ತೀನಿ. ನೀನು ಯಾರೇ ನಿಮ್ಗೆ ಏನ್ ಮಾಡೋದು, ಧೈರ್ಯವಾಗಿ ಹೇಳೋದು. ತಪ್ಪಂದ್ರೆ ಅದ್ರ ಇದೆ ಸರಿಪಡಿಸೋಣ. ತುಂಬಾ ಸುಲಭ, ಅದೇ ಕೊಟ್ಟಿಲ್ಲ. ಮೆನ್ಸ್ಟ್ರಲ್ ಸೈಕಲ್, ಮೆನ್ಸ್ಟ್ರಲ್ ಫೇಸ್ ಅಂದ್ರೆ ಏನು? ಆಡಿದ ಮೆನ್ಸ್ಟ್ರಲ್ ಫೇಸ್ 1 to 5 ಏನಾಗುತ್ತೆ? ಯೂಟ್ರಸ್ ಎಕ್ಸ್ಟೆನ್ಷನ್ ಏನಾಗುತ್ತೆ? ಹಾರ್ಮೋನ್ಸ್ ಏನಾಗುತ್ತೆ? ಅದನ್ನ ಹೇಳಿ ಮಾಡಿ. ಅದನ್ನ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿ ಹೇಳು. ಹೇಳು ಸರ್. ಆಯ್ತು
ಸರ್ 1 to 5 days. Menstrual cycle 1 to 5.
Okay, Sarad, Sarad, are you comfortable?
Sir.
Okay, just I share one video also, no? Just a minute. Just a minute, Okay, just try. I try the video when if audio is visible, audible, then let me know. Sam said maybe some setting is required to share the audio.
But it's different. Every girl's body has its own schedule. two structures in the brain.
Audio is coming, video audio
Yes, coming, sir.
coming. Okay, that's
Yes.
great. So, Sarad, especially look how basically ovulation happen. Means how menstrual cycle on baby born entire process.
The pituitary gland and the hypothalamus produce complex hormones that stimulate the ovaries to make female sex hormones that start and control the menstrual cycle. And it will continue till about age 51, usually lasting from 3 to 8 days. The menstrual cycle includes several phases. The first phase of the menstrual cycle begins on the first day of bleeding and lasts for about 14 days. The pituitary gland, located at the base of the brain, releases a hormone called FSH. This hormone causes one fluid-filled follicles contain a mature egg to develop. The maturing follicle produces the hormone called estrogen, which increases over and peaks in about day 12 and causes the lining of the uterus, endometrium, to become thicker and more enriched with blood vessels. In fact, the woman's body prepares to get pregnant. On about day 14, the high amount of LH and FSH cause the egg to be released from the ovary. The high level of LH also causes a brief surge in testosterone, which increases sex drive right at the most fertile time of the cycle. After release, the egg enters the fallopian tube. Tiny hairs in the tube's lining help push it down the narrow passageway toward the uterus. If the sperm cell can successfully meet an egg cell in the fallopian tube, the fertilization will take place here. Once the egg is released, the follicle seals over, and this is called the corpus luteum. After the release of the egg, levels of FSH and LH decrease. The corpus luteum produces progesterone. If fertilization has occurred, the corpus luteum continues to produce progesterone, which prevents the endometrial lining from being shed. If the egg is not fertilized, it disintegrates after about 24 hours. Then the corpus luteum also disintegrates, which causes progesterone levels to drop and signals the endometrial lining to begin shedding after about 14 days. The menstrual blood is partly blood and partly tissue from inside the uterus. It passes out of the body through the vagina. The period comes again every 24 to 38 days, from the first day of one period to the first day of the next. Besides bleeding from the vagina, you may have abdominal or pelvic pain, lower back pain, headache, fatigue, mood swings and irritability, food cravings, bloating and sore breasts.
Right?
Yes, sir.
Relatable?
Yes, sir.
Hope Sarad अभी explain कर पाएंगे मुझको.
And he has understood, but he is not able to explain.
Okay.
What he's telling is when the couple get intercourse.
Just share you one more video. Just a minute. Just look at this. This video has not any voice actually. I think.
The menstrual cycle begins with menstruation. Once the bleeding stops, the uterine lining becomes thicker and begins to prepare for the possibility of a pregnancy. Somewhere around day 14, an egg is released from one of the ovaries and begins its journey down the fallopian tubes to the uterus. If sperm are present in the fallopian tube, fertilization can occur. If the egg is not fertilized, the egg breaks down, and hormonal changes signal the uterus to prepare to shed its lining, bringing us back to day 1 of the menstrual cycle. Please watch my next video if you want a more in-depth overview of how menstruation works.
Okay. I hope Sarad will explain.
ಕನ್ನಡದಲ್ಲಿ ಹೇಳು.
Sarad,
Sir.
because our job is to speak na yaar. If I have a great knowledge, but I can't speak or I can't explain what I know, so this is the problem. Because our job is to explain all the things in such a way our customer or audience will understand, right? So if you have the problem in explaining, just try to explain, right? Yes, please. And Devarazu, you are going to call the Arun for the come on the video call. And even that your screen is again close. आप बुलाने के लिए गए थे और आपका स्क्रीन खुद ही क्लोज है. देवराजू. Yes, sir, please.
The husband and wife intercourse.
Loudly.
Sir, husband and wife intercourse. Sperm travel. Sperm travel through uterus. Fallopian tube. Fallopian tube.
आपको इतना ही समझ में आया?
Sir, I understand.
This is not first step. First step, dear. First we create the egg, na? First we create egg. First we generate the egg. Then mature the egg. Then we ovulate the egg. When ovulation happen, then sexual intercourse is required for the sperm. Before that, not. Before that, मैंने आपको बताया ना कि if you trying entire month, doing the entire month sex there, though pregnancy is not happen. Pregnancy time period is only 3 to around 4 days or 5 days only. Right. On that particular 5 days, if intercourse is not happen, and except these 5 days, you do the daily intercourse, the baby not happen. Right. For baby, you need to do the intercourse on that particular days only. That is called the fertile days. These things happen in every animal. Okay. So first you start with the egg formation. Where and when egg formation happen? First step.
After menstrual cycle.
Okay, if you have problem to explaining, just make a notes on the notebook. Just write down all the steps and show me. Then I will understand.
Right.
First step, second step, third step, fourth step. As just like that.
Step one, step one, very good. Very good. One to 5 days. So 1 to 5 days only. What will happen? The column I mentioned already. So I'm going to process it. Very useful. It's just simple. So right step. Step is going to day 1 to 5, sir. So 1 to 5, you will should see the it's a meaning period. Someone involved for the person to work based on who is to remember the stuff. And yeah. Because it was a work based on
No, understood.
so it's definitely-
Okay, Sarad, you have taking more time. I request to your manager just recap all the things. Have you any confusion? If you want to ask any question from my side?
Sir, for myself, sir.
Hmm.
No, nothing, sir.
Okay. So I go forward, right? In the tea time, just take him and explain on the process, as
Sure.
well as in the night time.
Okay, sir.
You sit with the Sarad and explain all the step by step process. I will also send the PPT,
Sure,
right?
sir.
That will help you a lot also.
Okay,
So
sir.
by using the PPT, you can explain him all the steps, because if you are not clarity about the menstruation cycle, if you are not the clarity about the how egg formation happen, how baby formation happen, then you can't understand our medicine.
Sure, sir.
Understand, because we have the medicines, they basically work, help in the egg formation. We have the medicine, they help in the ovulation. We have the medicine, they help in the irregular periods, right? So first we understand the normal situation, then we understand the disease. What happen if disease happen,
Okay, sir.
right? What happen in the disease condition? So first we understand the normal condition, then we'll understand the disease,
Okay, sir.
right? So this is your responsibility.
Sure,
And
sir.
Sarad,
Yes, sir.
you sit with your manager. If your manager not giving time to you, you have, this is your responsibility to take the time, right? Tomorrow, because we take the test, as well as tomorrow morning, this is your first, maybe first you present, then I will present. First you present the entire slide. After this today's session, I will share all the slides, whatever we shown here. All the slides I will send you. Right? You can take the printout, or you can just save your mobile, learn all the steps, and tomorrow you will present.
Yes, sir.
Right? Okay. Can I repeat all the menstruation related period and menstruation PPTs, or go forward? If you people need, I explain all the steps once again, then I
Yes,
will
sir.
do. If you have know enough, then I go with the brands. Sanjay,
Sir, sir, once you can recall it, sir, will be helpful for us.
so this is the main reproductive system of the female. The major part of the reproductive system in the female, one is the ovary, second is the fallopian tube, third is the uterus. These are the three major part which are responsible for the baby formation and menstruation. Right? These are the major three organs. One is the uterus, second is the fallopian tube, and third is the ovary. Right?
Yes, sir.
First we talk for the ovary, because ovary is a just like a egg factory. They always make a egg. Every month they make the egg, right? They make the egg as well as make two hormones. One is the estrogen, second is the progesterone, right? One is the estrogen
Estrogen.
and second is the progesterone,
Progesterone.
and release one egg every month, right? Release one egg every month. Second part is in the female reproductive system is the fallopian tube. This fallopian tube. The fallopian tube basically the thin tube that connect the ovary to the uterus. This tube connect the ovary to uterus. They secure the connection. This is a pipe. You can think that just like a pipe, they connect from ovary to uterus for the travel of the egg. For the travel of the egg, actually, right? So egg travel from here to uterus. So fallopian tube is a egg transporter, right? Fallopian tube is a egg transporter, and inner lining of this called the endometrium. This is the endometrium, and this is upper layer of the uterus that is called the myometrium, right? This is the myometrium, and this is the endometrium. Inner layer called the endometrium, mid layer called the myometrium, right? And this is the muscular structure called the uterus, or you can say the womb, or baby's home. If pregnancy happen, then baby sit in uterus and grow further. Right? This is the baby home where fertilized egg implants and grow into a baby, grow into a big baby. The entire 9 month baby sitting here and grow continuously. Right? If no pregnancy happen, then baby grow. If pregnancy not happen, in this scenario, this egg is diffused and the inner lining, this endometrium break down and come out through this cervix, right? This small opening in the cervix, cervix work as a gatekeeper. They allow sperm to go inner side to reach the fallopian tube, and they also allow the cells and bloods to come out. And if pregnancy happen, then they allow the baby to come out when baby enough mature, right? Open slightly during the menstruation and widely during the childbirth. Clear? This is the cervix. Vagina, this is the passage by which baby born. How it works, this is the all small steps. First step is the egg release from the process of the ovulation. The process of the egg release called the ovulation. The ovary release an egg. Second process is the fertilization. If sperm come, the egg meets the sperm in the fallopian tube and do the fertilization. Third is if fertilization happen, then next step is implantation. Pregnancy start, right? The fertilized egg attached to the uterus. They travel from fallopian tube to uterus and implant in the uterus and start growing. And if fertilization not happen, means intercourse not happen. Even the intercourse happen, but sperm will not reach the fallopian tube. That case, the menstruation happened, no pregnancy. The uterus shed its lining and just come out as a menstrual cycle or period. These are the basic steps. And friend, if intercourse happen, this is not necessary to baby born. Actually, sperm have to travel from vagina to cross the cervix, cross the uterus, then travel to this fallopian tube and reach to the egg. And this travel something around take the 24 hours. So many sperm actually dead before reaching to the egg. Understand? What is the normal concentration of the sperm in one ejaculation? Have you aware about that? Okay, चलो उसको हम दूसरे टॉपिक में बात करेंगे. But अभी this is clear. Sarad, have you clear these all the steps?
Yes, sir.
And in this some hormones involved actually. For the making of the egg, follicle stimulating hormone is responsible. This is called the FSH, right? FSH is responsible to mature the egg. right? FSH is responsible to mature the egg. Yeah, you can say that mature the follicle basically, right? That is called the follicle stimulating hormone. Second hormone is estrogen and progesterone that regulate the menstrual cycle. And third is hormone is LH, luteinizing hormone, that is responsible for triggering the ovulation, right? The luteinizing hormone or LH is responsible. Is LH is not proper available, the ovulation not happen. So egg not come out from from ovary to fallopian tube, right? These are the small steps. So menstruation phase, follicular phase, ovulation phase, and luteal phase. This is the name of the phase. So four phase happen in the period menstruation cycle. Menstrual phase 1 to 5, where menstruation continuously happen, bleeding happen, females using the pads, right, to absorb the bleeding. Second, after bleeding, when bleeding end, then follicular phase started, where follicle start maturing, right? And in the day 14, ovulation phase come, the ovulation happen, egg come out from ovary to fallopian tube for the fertilization, wait for the 24 hour to 30 hours for the fertilization. When sperm is come, then the fertilization. If sperm not come, the fertilization not happen. And luteal phase is, if pregnancy happen, then yes, baby start just plant in the uterus and start growing. And if pregnancy not happen, then everything is set and come out as a menstrual cycle, right? Which hormone, you can take the screenshot of this also, that will help you for you people. Sarad, clear? Sanjay?
Yes, sir.
हाँ सर.
So हम लोग आगे चलें अभी.
हाँ, sir.
So Sarad and Sanjay, you have to do more practice,
Sure.
please, because without practice you can't understand the brand, right? So understand each and every, this is very simple way, very simple steps actually, but when you understand then understand the brand same. Okay, so we come to the brand. So our first brand is Medihymnic. So first brand name is Medihymnic. Medihymnic. In iron deficiency in pregnancy and lactation, doctor please prescribe Medihymnic, the brand of ferric pyrophosphate liposomal 12 milligram, vitamin C 80 milligram, folic acid 146.47 microgram, cyanocobalamin 2.2 microgram, and soa lecithin 30 milligram. Suit up HB label, या suit up hemoglobin label. If you speak in full form, that is much better. Suit up the hemoglobin label. So we just understand the brand Medihymnic. So before going to the brand, friend, we understand the disease. What is anemia? Because iron used in the anemia, right? We know these things. Iron basically used in the anemia to prevent the anemia. But what is the anemia? आप में से कोई बताएगा? Anyone can explain the anemia? What is anemia? What happened in anemia? Sarad,
Blood hemoglobin contains.
please speak loudly.
Blood hemoglobin contains. Blood hemoglobin.
What happened in anemia? Problem क्या होती है?
The healthy blood doesn't have a particular which the body required.
संजय,
Hemoglobin count will be down.
प्रॉब्लम क्या होती है?
Sir, problem.
What problem happen? Symptoms. If anemia happen, patient how they suffer? What exactly problem they face? What problem exactly they face?
Sister,
Tiredness.
Sir,
Yeah.
very tiredness, sir.
Hmm.
Like oxygen increasing heartbeat level high, sir.
Sorry, please speak loudly, yaar.
Increasing heartbeat AD high, sir.
Increasing heartbeat.
Yeah, sir.
Okay. Any other symptom?
Some dark circles will happen near eyes.
Dark circle happen. Okay. Good.
Giddiness will happen.
Sir, oxygen level is very low, sir.
Okay, no issue. प्रॉब्लम क्या होगा उससे?
Sir, oxygen
ओके, ऑक्सीजन लेवल लो हो गया बॉडी में, प्रॉब्लम क्या होगा उससे? व्हाट प्रॉब्लम हैपन इफ ऑक्सीजन लेवल इज गोज डाउन इन बॉडी? ओके, डू यू नो द फंक्शन ऑफ ब्लड? व्हाट दे डू इन आवर बॉडी? व्हाट इज द फंक्शन ऑफ ब्लड?
The food what we intake, it will travel through blood to the whole body.
Then what benefit we get?
The supplements, what are the good supplements we will intake? It will reach all the organs in our body.
Okay. And what hemoglobin do?
Hemoglobin.
What is the function of hemoglobin?
The blood count increasement. It increases the blood count.
Huh? I mean, it's very simple. Yeah, you know, doesn't know the work of the blood, work of the hemoglobin. It's shameful. It's surprising for me. You doesn't know the function, basic function of the blood. What do the blood? Just one thing, one Sanjay or Sarad, have you any point?
it carries
आपकी बॉडी में ब्लड क्या करता है?
oxygen from lungs to
What blood do in your body? Just feel that, na?
carry the oxygen.
Sir, it carries oxygen into the lungs.
Very good. Carry the oxygen to lungs.
Lungs.
Not dear. They carry the oxygen from lung to body, not in lungs. Carry the oxygenated blood and nutrients. The basic, a lot of function do blood in our body, but mota, the basic function of the blood is to carry oxygenated blood along with nutrients to entire body. They blood is a channel. They basically supply. They are supplier of the nutrients. Second, oxygen. Right?
Yes, sir.
One is the nutrients. Second is the supplier. So what happen if deficiency of these two occurred in body?
Anemia.
Anemia क्यों हो जाएगा यार? If what is the work of nutrients in our body? For think logical na. Why we eat foods?
For strength.
Hemoglobin level that's right.
Why we are taking meals? Why we are taking the nutrients, fruits? Why? What they do in our body? Okay. चलो थोड़ा और सिंपल करते हैं.
Nutrients in our body.
बाइक में पेट्रोल क्या काम करता है?
Vitamins,
Sir?
minerals.
What is the role of petrol in your bike? What they do?
बाइक चलाने के लिए पेट्रोल चाहिए।
वो तो मुझे
ऐसा
भी
है।
पता है। वो
हाँ,
करता क्या है जाने के बाद?
वो ब्लड को ट्रैवल करने में मदद करता है।
पेट्रोल?
नहीं नहीं, न्यूट्रिएंट्स।
सी कार्बोहाइड्रेट्स प्रोटीन्स
अभी मैं पेट्रोल पूछ रहा हूँ क्या करता है?
हाँ, बोलिए बोलिए सर, पेट्रोल।
गाड़ी में।
पेट्रोल क्या करता है बॉडी में?
गाड़ी का
बॉडी में, सॉरी, बाइक में।
सर मैं वही सोच रहा हूँ, बाइक चलाने के लिए पेट्रोल चाहिए, वो जो
हाँ, करता क्या
पेट्रोल।
है? ये तो मुझे भी मालूम है, बाइक चलाने के लिए पेट्रोल चाहिए।
नहीं,
विटामिन सर, विटामिन।
पेट्रोल।
वो बाइक में जाने के
फ्यूल
बाद क्या
फ्यूल जैसे
करता है,
काम
कहाँ
करता है।
जाता है, क्या होता है पेट्रोल का?
पेट्रोल वो ट्रैवल करता है थ्रू पाइप के कार्बोरेटर पे जाके इंजन पे जाके बाइक चलाने पे मदद करता है।
क्या मदद करता है? होता क्या है पेट्रोल का उधर? मदद कैसे करता है?
पेट्रोल
फ्यूल फ्यूल जैसे एक्ट करता है।
हाँ?
फ्यूल होता है सर।
नहीं, फ्यूल होता है, होता करता क्या है वो?
बर्निंग।
उससे क्या होता है बर्निंग से?
कंबशन।
कंबशन। तो ये पहले आप कैमरा तो ऑन करो। ओके, कंबशन होता है, राइट। इंजन के अंदर बेसिकली क्या होता है? रिंग एंड पिस्टन्स होते हैं फ्रेंड। रिंग एंड पिस्टन्स को अप एंड डाउन, जिससे हमारा जो पहिया होता है, राइट, जो व्हील्स होते हैं उनको चलाने के लिए क्या चाहिए? अप एंड डाउन, राइट।
लुब्रिकेशन करता है।
तो वहां पे कंबस्शन होता है। थ्रू द कंबस्शन, जो वहां पे रिंग एंड पिस्टन है, जो पिस्टन है वो बार बार अगेन एंड अगेन अप एंड डाउन होता है, जिसके थ्रू हमारा व्हील्स रोटेट करता है, राइट। सो पेट्रोल इज रिक्वायर्ड फॉर डूइंग दैट पर्टिकुलर combustion. When combustion happen, then piston up and down. Same thing our food, our nutrients do in our body. Our body is made up of millions, billions of the cells. Each cells doing his own work. And for the doing work, they need energy. Right? They need energy. And where they get the energy? From nutrients. For our functioning of the cells, cells need energy. जैसे आपको यार मीटिंग अटेंड करने के लिए क्या चाहिए? खाना चाहिए ना। अभी भूखे रहोगे तो मीटिंग हो पाएगा क्या? नहीं हो पाएगा ना। इफ यू हैव
नहीं,
द हंगर, यू कैन अटेंड द मीटिंग। नो, बिकॉज आपका माइंड जो है, योर माइंड माइंड ऑलवेज थिंकिंग फॉर द फूड, दे आर नॉट लिसन द प्रेजेंटेशन, right? Same happen with the cells. For the normal functioning of the cells, they require the nutrients. They burn the nutrient, they use the nutrient to function. So when we take the food and oxygen, right, why oxygen is required? Because oxygen used by the cells, and in the oxygen they mix other gases to excrete the waste material. Our blood carry the nutrients and oxygen, and after using they also carry from organ to lungs what? Deoxygenated blood, means carbon dioxide and waste material, right? So nutrients required for the normal functioning of our body cells. Okay. And what happen in case of anemia? In case of anemia, hemoglobin level will goes down. Right? What happen? Hemoglobin level goes down. Hemoglobin means hemoglobin. Hemoglobin made up of two things. One is the heme,
Supplies the
second
oxygen.
is the globin protein. So iron attached with the globin protein, so called the hemoglobin. Or you can, in the layman language, you can say that if hemoglobin level reduced, the carrying capacity of oxygen is reduced, right? So RBCs and hemoglobin is responsible for the carrying of the oxygen. If more number of hemoglobin is present, more number of oxygen will carry. Right? If hemoglobin number is reduced, then carrying capacity of the oxygen in the blood is reduced. Understand? When
sir.
oxygen molecule reduced, then work capacity of our body is reduced. Because for working our body, for our cells, they need energy, na? They need oxygen, they need nutrients. Right? When nutrients is not available, because the carrying agent is not available. Which one is the carrying agent? Hemoglobin, RBCs. If they are not available, their number is reduced, the appropriate nutrition will not reach to the body organs. And if not reach the appropriate, what happen? Thakavat, tiredness, weakness. Because our bodies is not working properly now. Because they are not getting the energy, they are not getting the nutrients. ऐसा समझो कि जैसे आपको 2-4 दिन खाना ना मिले तो कैसे हो जाओगे, वीक हो जाओगे. राइट? बिकॉज आपको जो रिक्वायर्ड, यू हैव टू राइट मील फॉर द रेगुलर एनर्जी. Same thing happen in the anemia. Right? In the anemia is a disease, friend, where the number of hemoglobin is reduced. Anemia is a condition where red blood cells or hemoglobin level are low, leading to the reduced oxygen supply in the body. When reduced oxygen supplies happen, then weakness happen, then different other conditions happen. Soon I will explain. So what is the reason for the deficiency of oxygen or anemia? Iron deficiency, most common, right? Iron deficiency, vitamin B12 deficiency, folic acid deficiency, or sometime chronic kidney disease, that is also called the CKD, chronic kidney disease, also responsible for the anemia. Blood loss due to injury, due to menstruation, due to ulceration. आपने कभी जेंट्स को आयरन की गोली को खाते हुए देखा? Have you seen ever any male candidate have taking the iron tablets? No, right? ऐसा नहीं है, लेते हैं many male when iron deficiency happen, then many male take, but usually not, because female have the every month menstruation, they lost the blood. Every month they loses the blood. Because of that reason, the chances of hemoglobin lesser, anemia in female. Genetic disorders like sickle cell anemia, thalassemia, where the capacity of body is not enough to produce the hemoglobin. That is called the sickle cell anemia or thalassemia. Symptoms. These are the symptoms of the anemia: fatigue, weakness, pale skin, means yellowish skin will be yellowish, shortness of the breath, proper you can't take the breath because of oxygen deficiency. Dizziness, headache, rapid heartbeat, increase of the heartbeat. These are the symptoms. Clear? Everyone
sir.
understand the anemia?
Yes, sir.
Please let me know.
Yes, sir.
Yes,
Yes,
sir.
sir.
Have any confusion about the anemia?
Sir.
No. Okay. Second brand, we have the Dynacoral.
Dinosaur.
Dynacoral. Okay. So this is the calcium brand. I just attach with the iron because if we talk for the use of the iron, same time we need the use of the calcium, right? Because our major prescriber, which one is the gynae, right? So we basically promote the iron as well as calcium in the pregnancy. Because of that reason, I club these two brands, calcium and iron, right? Why pregnant women need iron and calcium? Anyone can explain why pregnant women need the iron and calcium?
So calcium is required because for the pregnant women, for the growth or development of the babies
Hmm.
and development of fetal.
Hmm. Development of
Development of baby to grow.
baby to grow. Okay. And संजय आप क्या बोल रहे थे?
सर fetus बोला था मैंने.
ओके, चलो. बेबी को जब ओम्ब के अंदर होता है तो उसको हम फीटस भी बोलते हैं. ओके सर. जब बेबी स्मॉल सा बेबी हमारे बेबी मतलब प्रेगनेंसी में जब होता है तो उसको आप बेबी भी बोल सकते हैं, बट राइट वर्ड इज फीटस. राइट. FOETUS. फीटस. So why pregnant women need iron and calcium? Because many things happen when pregnancy happen. Pregnant women need iron and calcium supplement to support the growing baby and maintain their own health. So both baby as well as जो pregnant women है, both are required the iron and calcium. What they iron and calcium what they do? Basically they increase the blood volume and oxygen supply. During pregnancy, a woman's blood volume increased by 30 to 35% to supply oxygen and nutrient to the baby. Because baby need extra blood, right? They need extra blood. So the blood supply increased 30 to 50%, and that time the oxygen, extra oxygen also needed. Iron is needed to produce the hemoglobin, which carries oxygen in the blood. And if iron level are low, it can lead to the anemia, causing fatigue, weakness, and complications like preterm birth or low birth weight. If iron deficiency happen, then baby can before the time, that is called the preterm birth, like 7 month, 8th month. First, second, if naturally happen 9 month, then maybe chances their weight is lower side, right? If iron deficiency happen. Second, baby brain and organ development. Iron is essential for the baby brain and organ development. A deficiency can increase the risk of the development delays and the low birth weight. Third is the bone and teeth formation. The baby bone and teeth start forming in the first trimester. If the mother does not take enough calcium, the baby will take the calcium from the mother bones, leading to the weak bones and risk of the osteoporosis in the mother later. If proper calcium not taken by the pregnant woman, so baby start taking the mother bone calcium. In our bone, calcium is present. In our bone, calcium, magnesium, zinc, and phosphorus. These four ingredients is present in our bone. So for the growth of the baby, calcium is required. If oral supplementation नहीं करते हैं हम calcium का, in that scenario, they start taking the calcium from bone. On the later stage, the female can be osteoporosis or maybe osteoporosis. Understand? Because of that is an external iron as well as calcium supplementation is required in the pregnancy. Prevention of pregnancy complications. Prevention of pregnancy complications like iron help prevent the preterm labor, low birth weight, and postpartum hemorrhage. Right? Postpartum is after baby delivery. During the baby delivery, a lot of blood loss happen. So after baby delivery, body need to recover. That time iron will help. Calcium reduce the risk of high blood pressure, pre-eclampsia. The disease called the pre-eclampsia. Calcium reduce the risk of high blood pressure, which can be dangerous for both baby and mother. So calcium help friend to maintain the optimal heartbeat of the baby as well as mother. Maintaining maternal health. Pregnancy put extra strain on the mother's bone, heart, and muscles. Iron prevent maternal anemia and weakness, and calcium keep the mother bones and muscles strong. So because of that reason, we need the external calcium and iron. So you people are understand why calcium and iron needed in pregnancy,
Yes, sir.
right? Because baby grow कर रहा है, baby need the iron, baby need the proper blood supply, and for the proper and regular blood supply, we need the iron. For the proper bone development, for proper teeth development, for proper brain development, we need the calcium. And for maintaining the heartbeat, we also need the calcium. Understand? Have the clarity
sir.
about the calcium and iron?
Sir.
Yes, sir.
Why calcium and iron needed in the pregnancy? Right?
Yes, sir.
Second, we understand why our medihemnic is better as compared to the other iron in the market. Right? Why medihemnic is better as compared to the other iron? So first we understand the how our medihemnic work. So our brand contains ferric pyrophosphate, vitamin C, folic acid, cyanocobalamin, and soa lecithin. Right? These are the ingredients. You have to remember all the ingredients with the composition, friend.
Yes, sir.
Tomorrow in the detailing, I will listen all the page detailing. So yes, brand name and salt name composition you have properly remember. So just look at the mechanism action of the mediheminic. So ferric pyrophosphate, it is a iron, and this is a liposomal form of the iron. Provide elemental iron for the hemoglobin synthesis. Liposomal iron form enhances absorption and reduce the gastric irritation. Helps in the oxygen transport and prevent the iron deficiency. Right? एक काम करते हैं, थोड़ा सा टी ब्रेक लेते हैं. मुझे लग रहा है मैं जब कुछ बोल रहा हूँ, आई एम स्पीकिंग वॉट एवर यू गोस above the sir, above the head actually. Right?
Sir.
So take the 15-minute tea break, then we understand.
Okay.
Right? I will send the next link. So connect with that particular link. I close this link and connecting in the 4:10. Right? 4:10 p.m.
10.